Invite you to this special session on fresh insights at the South Asia SBCC conversation. I'd like to welcome our wonderful speakers here for the morning who joined from across South Asia. So that's fantastic for us. And before we start, I just want to set some ground rules. Can I ask all participants to stay muted during presentations, after your presentations, and all visitors, please do stay muted. If you have questions, do type them in the chat. We have volunteers here, wonderful volunteers who've been looking at all the questions. And after each presentation, we will take up the questions for the speakers. I also request everyone to make sure that you're in a good network space. I mean, I know it's a bit too late to say that, but let's just make sure that there are no technical glitches here. And finally, at the end of it, let's make sure that all of us enjoy ourselves during the session and go back with learnings from each other. So to start off the day, I'd like to do a quick recap of what happened in the morning. The session started at 10 a.m. And we had a wonderful presentation from Paritosh from Feeding from Far, who actually captured the power of social networking in the entire social and behavior change communication space, where they addressed an issue that matters the most to most communities, which is hunger. And it really shows us how in these times, digital has come forth to kind of provide that extra support to SBCC and all the wonderful work that you do on the ground. And right after that, we had Johns Hopkins University share the COVID dashboard with us, which again shows us the power of data in today's time and how important it's been during the entire pandemic. So to start off, I am Nirmala Nair. I'm the moderator for the day. I run a social impact agency called Kaboom in India. And I'm welcoming all our speakers. And to start off the day, we have our very first speaker, which is Indra Dhoj Kshetri from Nepal. Indra Dhoj is a senior manager, outreach and risk communication at the Helen Keller International, where he works for the USAID-funded SWARA Good Nutrition Program. He provides programming guidance to the social and behavior change communication component, as well as leads risk communication in the context of COVID-19. So over to you, Indra, and Shohini, I request you to start the presentation, please.
Hi, everyone. Greetings from Nepal. I'm Indra Dhoj Kshetri. I work as a senior manager, outreach and risk communication for USAID SUARA 2 program in Nepal. The program is implemented by a consortium of 7 organizations led by Helen Keller International. Today, I'm going to present about our experience of developing a television commercial using real-life human characters amidst the COVID-19 pandemic context. Just to give a brief background on SUARA 2 program, it's a multi-sector nutrition program working at a scale at in over in 42 of Nepal's 77 districts. As you can see, the dark blue areas. So we cover more than half of the geographical territory and serve more than 40% of the country's population. After the COVID-19 came, we also started supporting the government of Nepal in preventing the spread of the COVID-19, and currently we're also supporting the government in vaccination rollout. The key component of the support are risk communication and community engagement, case identification and contact tracing, laboratory support, infection prevention and control, among others. But today I'm going to focus on risk communication and community engagement. So as you can see, the picture in the right is something that all of us relate to the coronavirus image. Um, so during the early phase of COVID-19 risk communication, our focus was on ensuring uniformity of messages, images, icons, illustrations, and animated characters. Our focus was on getting the message out, getting the correct message out, and um, That's why most of the partners used this image, and I think the first phase was pretty successful on providing the information to the communities. But is the situation, changed and the pandemic prolonged? People started, developing information fatigue. Uh, that was aided by by the overuse of these images and animated characters, because all the time only the same image and same animated characters with no connection to the people's real life will were used to communicate. So here, even though the messages were changing, as the image remains constantly same, people started uh, getting confused, or not giving attention to the message that was aided by the image. So we thought that something with real life human characters, the people could relate to, the settings the people could relate to would be great. That's why we came to a conclusion that three key problems at the time uh, were testing hesitancy, and the information about home isolation, and also the continuous use of mask even after the lockdown or restrictions are eased. So to address this, we developed a three-part series. Just the context is important. We were able to do that at the at the almost after the peak of the second wave in June July this year. Uh, so as just mentioned, the first part focused on addressing testing reluctance. Let's watch it. The video itself.
जीवन तिमी सामान लिन जाने भने हैन अझै गएको छैनौ
कस्तो जिउ दुखिरहेछ भने आज अलि गाह्रो पो भइरहेछ त
ल के भयो त अचानक बिहानसम्म त ठिकै थियो त
बिहान अलिअलि सुरु भएको थियो अहिले त अलि बढी नै हुन थाल्यो
ज्वरो आउने खोकी लाग्ने घाँटी दुख्ने रुगा लाग्ने र सास फेर्न गाह्रो हुने जस्ता समस्या देखिएका छन् भने तुरुन्तै कोभिड-19 को परीक्षण गराउनुहोस्
कतै तिमीलाई
तिमी पनि कहिलेकाहीँ यस्तो भइहाल्छ नि अब यति हुँदैमा कोरोना भन्न कसरी मिल्छ भन त
के थाहा अहिलेको भाइरसको त लक्षण पनि कति धेरै छ रे अनि पहिलाको भन्दा संक्रामक र कडा पनि छ रे
तिमी झन् डर नदेखाउ न मलाई सामान्य दुख्या हो के केही भएको छैन
यो बेला डर देखाउने भन्दा पनि जाँच गरेर ढुक्क हुने बेला हो बरु गएर जाँच गरेर आउ न
पर्दैन के
हेर यदि तिमीलाई कोरोना लागेको भए तिमी हामी सबैलाई खतरा भयो अनि पुरै परिवार नै जोखिममा भयो के तिमीलाई हाम्रो माया लाग्दैन
हुन्छ अब तिमीले भनेपछि मान्नै पर्यो नि
समयमै परीक्षण गरी रोगको पहिचान भयो भने आफूसँगै आफ्नो परिवारलाई पनि कोरोनाबाट बचाउन सकिन्छ
तपाईको ज्यानको सुरक्षा तपाईकै हातमा छ
सतर्क रहौं सुरक्षित रहौं
Yes, and the second part focused on because in the second wave of COVID-19, more than 90% of the people were recovering at home. All of us know that the scarcity of oxygen at hospitals, the ventilators, even beds at the hospitals. That's why we had to provide some useful information, some basic information on what they can do at their own homes while they're isolating at their own homes. So the second part focused on home isolation basics. So we can link it with the first one. For example, in the first one, there was a testing hesitancy. The character went for testing, and if he is found positive, what he will do. That was the logic, the three-part series that we thought. And the second part now talks about that home isolation basics. Let's watch it.
मैले पनि सामान्य ठानेको थिएँ तर पोजिटिभ देखियो पोजिटिभ देखिए पनि सामान्य लक्षणको अवस्थामा त्यति आत्तिहाल्नु पर्ने चाहिँ होइन रहेछ म 3 दिनदेखि घरमै एकान्तवासमा बसेको छु तर एकान्तवासमा बस्दा पनि आफ्नो स्वास्थ्यको विशेष ख्याल चाहिँ राख्नुपर्छ आफ्नो शरीरको तापक्रम र अक्सिजन नापिरहने हल्का व्यायाम गर्ने बिहानको घाम ताप्ने, प्रशस्त मात्रामा आराम गर्ने।
जीवन
ए
अहिले कस्तो छ तिमीलाई?
अक्सिजन ठिकै देखियो अनि अहिले ज्वरो पनि घटेको छ।
ठिक छ। एकान्तवासमा बसेको समयमा पोसिलो खाना, गेडागुडी, माछा मासु अन्डा खानुको साथै तातो झोलिलो पदार्थ प्रशस्त मात्रामा पिउनु पर्दछ।
डाक्टरको सल्लाह मान्ने र यति गर्दा गर्दै पनि गाह्रो भएमा तुरुन्तै नजिकैको अस्पताल वा स्वास्थ्य संस्थामा थप उपचारका लागि जानुपर्छ।
तपाईको ज्यानको सुरक्षा तपाईकै हातमा छ।
सतर्क रहौं,
सुरक्षित रहौं।
Yes, and the third part is on so in the third part we we envision that the person has recovered from the uh, COVID-19, and he has a full sense that I have got the immunity, the lockdown is eased, I can go out even without wearing mask. So this is where we are, we want to focus that even if the restrictions are eased, or you might have recovered from COVID-19, but it is still important to put the mask on. So let's watch the third part.
हजुर दिदी, जीवनलाई एकदमै ठिक छ दिदी। हजुर, सामान्य लक्षण देखिएको अवस्थामा घरमै राम्रोसँग ख्याल गर्यो भने पनि निको हुने रहेछ। अहिले हामी बाहिर जान लागेको राखिदिन्छु ल।
जाऊ इन्ड्रा।
तिम्रो मास्क खोइ त।
अब पनि के लाउनु, लकडाउन पनि खुलिसक्यो, अब त कोरोना नि सकिसक्यो होला।
ल, लकडाउन खुल्नुको मतलब भाइरस संक्रमण कम भयो भन्ने हो त? यो त सबैलाई सजिलो होस् भनेर पो गरेको त।
फेरि नतर्साउ न यार।
हो, यो हो नि त तरिका। अहिले घर बाहिर जाँदा आउँदा कोरोना संक्रमणको जोखिम झन बढी हुन्छ। त्यसैले जरुरी कामले घर बाहिर जाँदा भ्याक्सिन लगाएका वा नलगाएका सबैले अनिवार्य रूपमा मास्कको सही तरिकाले प्रयोग गर्नुपर्दछ।
संक्रमण नियन्त्रणका लागि मास्कको प्रयोग एउटा भरपर्दो माध्यम हो।
तपाईको ज्यानको सुरक्षा तपाईकै हातमा छ। सतर्क रहौं, सुरक्षित रहौं।
Yes, and as I said, we had envisioned this only as television commercials, but once we released the videos, or once we came up with the product, we also realized that these images could also be used for print merchandise. So we adapted these images into flex prints, posters and stickers, so that um, they could be used for spreading the awareness. And we also did their voice in radio, and we also developed Aston and LSF ads to broadcast during various occasions like cricket match or football match live broadcast in television. So this is how the same images could be used for multiple media platforms. And the result, when we released these videos, because these were the videos for the first time, and first time with real human characters, and in Nepal at least, and also the these two characters are couple in real life setting. That's why people could relate to it more, and also their celebrity status or their own popularity also helped to push these videos. So when we released, we received more than 10 million views in 3 of these videos, and about 1 million was through on-paid traffic. That's quite impressive for a small country like Nepal. And more impressive was the audience retention rate. 40% of the audience exposed to the video watched it for more than 15 seconds, and that means for Facebook videos, if it is watched more than 15 minutes, it is sticky. So I think all these things helped to make the video sticky, and even you can see in 2.4 million for this just one video, in 2.4 million views, reach, we had almost 23,000 comments or reactions. Um, uh, I think that's important. So that also leads to some of the lessons for the SBCC community, and most of us will agree that it is important to continuously adapt the RCC strategy, and not only the strategy, we should look at it from content production to the delivery and distribution. So we should keep that always in mind. Secondly, the timing is crucial. I must mention that when we released this video, and especially the print merchandise, this coincided with the government's Mask Week campaign. So the campaign started with "Where is your mask?" and hugely our materials were circulated, not only in our program district but also other partners were happy to reproduce and distribute these materials, especially the print merchandise. That was quite impressive because that led us to broader partnership. The police were carrying our materials, the flex prints, the other organizations were happily hanging it in their um, help desk, or in their um, um, in their platforms. So uh, that is something I'd like to emphasize. And thirdly, uh, we should continue to seek the innovations within the given limits. The pandemic or other restrictions also can happen for us as communicators, but we should continue to see how we can circumvent these restrictions. So just a few implications for the field. One important implication is that the barriers that the restrictions in pandemic scenario, or sometimes even in the political scenarios, can be circumvented. um, and here, this is another important thing. One good investment can yield many outcomes. For example, we as I said earlier, we just envisioned it as a television commercial, but we could do it in print, radio, and many things. And finally, adaptation is a continuous process. As I said, we did video and then radio and then print and then also SN and LSF. So the same materials can also be adapted in many forms and formats, and that's a continuous. And I'd like to thank this presentation by thank. I'd like to end this presentation by thanking my co-authors, Pooja Pandey Rana and Dipak Sharma, both of them working for Suara 2 program. Thank you.
Thank you so much, Indra, for that wonderful presentation and the lovely videos. And I think one of the things that you touched upon about, continuously adapting is something that the pandemic taught us really, really well, because I think every day there was new information coming out. And there was a very interesting conversation in the chat that you had with Gita while this was going on, and I want to share that with the audiences, to tell you that everyone who works on SBCC kind of had a sort of a tough time when it came to the pandemic, because the information was coming in spurts and every morning you had new information. So to be able to adapt and sort of continuously incorporate that information also becomes difficult. So the conversation was Gita asking Indra why were there single-use masks being shown in the videos. And Indra, I don't know if you want to give the answer yourself and tell everybody, why did you choose to use single-use masks?
Yeah, as I said, by then we didn't have so much of evidence that the reusable mask can be, useful to protect from the COVID-19. And also with reusable mask, we had other barriers as well, because that was not easily available, the quality, etc. That's why we used the reusable mask. Yes.
It's very true. I remember in our own communication work that we were doing in India, the same similar things came up. Should it be a reusable mask? Who's going to vet the fact that the reusable mask works?
Yeah.
Where does one get a reusable mask from at that point of time? Exactly. Do you make your own mask? Is that effective? There were so many conversations around that. And I think as SBCC professionals, those become like very challenging at that point of time, right? Along with that, there's something else that you mentioned in your presentation, which I thought was very interesting, which was about the fatigue, like about complete this information fatigue that came with the pandemic. And that's a real challenge that everyone working on SBCC faced, right?
Yeah,
That you
right.
had all these materials ready, and then suddenly you realize, oh my God, I don't know how to get more material because it's so difficult right now. And so tell us a bit about that experience. What happened when that fatigue? How did you sort of cope with that challenge?
Yes, that's why, I mean, um, always the images remained same, but we changed the messages because the evidence was changing, the new variants were coming, new information had to go out. But we had our ears in the community. We were listening constantly to our frontline staff. Nearly more than 1,000 staff were still working in the community despite the lockdowns, because they are from the same communities. They were there, and we were listening to them, and we constantly received that information that people are not giving attention to the message that is accompanied by the similar type of images, or animated images. That's why we had to find real life human characters, and because the transmissibility or the risk with making this was so high, that we had to find real couple. That's why they were living in the same house. That's why even if we took in the same video, at least we won't be blamed for if there is any any infection. So yeah, these were the things that we had to do, and these two characters that we used are really popular among the Nepali audience. And that's why I think that blew off the popularity of our videos. And the other thing I would like to highlight here is, during the second wave of COVID-19, the human agency was too low. There was so much of news around, hospitals, ventilators, oxygen, beds, etc. And people felt that, oh, the COVID second wave has come and there's nothing we can do. That's why we wanted to re-emphasize that in each video. At the end, you will see, stay alert, stay safe, your safety is in your own hands. So that is why we wanted to emphasize that you have the agency. More than 90% people are recovering at home isolations. So you can, if you follow these simple guidance, you can recover at home, you can protect yourself. That was also another thing we were trying to communicate. And there is,
Thank you, Indra. Thank you so much for that.
Just one more, Nirmala. Just one.
Yes.
There was something from Rimsa. Yes, we could have done the disposable utensils, but we produced it during the lockdowns. And also the use of, if we started promoting disposable utensils, that would be another barrier, because not all villages, not all houses will have that. That's why we had thought about it, but we considered to use it. We use the reusable utensils. Thank you.
Thank you, Indra, for that very, very insightful presentation and the discussion. I think we're now going to move on to our next speaker, which is Rimsha Zain. Rimsha is a communication and reporting assistant at the Save the Children Pakistan country office. She is a UK Vice Chancellor PhD scholarship holder. So over to you, Rimsha. Let's see what you've done there.
Save the Children implemented a hygiene behavior change campaign (HBCC) utilizing a strategic risk communication and community engagement approach to encourage improved hygiene practices for the prevention and control of COVID-19 in Pakistan. My name is Rimsha Zain, and today I'm going to take you through some of the media products developed for the campaign and discuss the methods and principles that informed our campaign strategies, messages, and assessments. When the COVID-19 pandemic hit, the major need was to educate the public around hygiene principles, spread of disease, and the possible options to treat it. Hence, Save the Children conducted the HBCC mass campaign on the prevention and control of COVID-19 in Pakistan in partnership with Unilever. The campaign connected local audiences to the global efforts to improve hygiene practices. Key messages were informed by Unilever HBCC technical guidelines, WHO, Government of Pakistan, and Save the Children COVID-19 advisories, focusing on the need of children, parents, and caregivers. The campaign reached total about 98 million individuals through various platforms including television, radio, digital media, and print media. To give a comprehensive preview of our HBCC campaign activities, interventions, and impact, I am going to showcase this short documentary on the project.
Of coronavirus. The World Health Organization believes the discovery will help authorities around the world detect and respond to outbreaks.
COVID-19 has reminded us to center our attention on hygiene and sanitation practices. Like the rest of the world, the pandemic has seriously affected Pakistan. Following the progress in responding to the first wave, the country is bracing itself to deal with an even more dangerous second wave of infection. As the government reopens the schools, both parents and teachers all across Pakistan are concerned about the need for improved facilities for sanitation and hygiene in schools. Save the Children Pakistan, with the assistance of Unilever and DFID, has initiated and implemented the Hygiene Behaviour Change Coalition HBCC project to support the response to the COVID-19 pandemic in Pakistan.
The primary objective of Save the Children Hygiene and Behavioral Change Coalition was to prevent the children from the COVID-19 along with their families, wider communities, and also to build the resilience for the future outbreaks.
The key activities of the campaign included mass media communication, distribution of hygiene kits, and installation of hand-washing stations at key locations to help initiate the necessary behavior change and to sustain it through the training of local stakeholders and teachers. The mass media campaign included one national TV public service message, 16 radio spots, 2 animated public service messages and other digital information material, and messaging banners and flyers in local languages to ensure a broad reach. Through the distribution of hygiene kits and touchless thermometers, as well as gifts in kind that included soaps, hand sanitizers, and surface disinfectants, the campaign effectively introduced better sanitation habits in several underprivileged schools and communities.
हमारे वॉश पॉइंट लगे हैं स्कूल में काफ़ी और यूनिलीवर और सेव द चिल्ड्रन इन लोगों ने काफ़ी ज़्यादा कोऑपरेट किया हमारे साथ बेसिक हम लोग को काफ़ी चीज़ें प्रोवाइड की हैं सैनिटाइजर्स सेफ्टी किट्स और हैंड सोप्स वगैरह.
To present a model to address the poor water, sanitation, and hygiene infrastructure in many of such schools and communities, 170 inclusive hand-washing stations were installed. With the training of 367 local teachers, the campaign is helping the communities on a path of sustained behavioral change to fight the pandemic.
स्कूल में एंटर होते वक्त भी और ये जाते वक्त भी बार-बार इस हैंड वॉशिंग पॉइंट्स हाथ धो रहे हैं. ये इनकी ट्रेनिंग भी करवाई गई, बच्चों को बताया भी गया है, क्लासरूम्स में भी जाकर भी बताया गया है और हर टीचर्स भी बच्चों को उसने सेपरेटली भी बताया है.
But more than just numbers, a survey report prepared by Save the Children on knowledge, attitude, and practices among the respective communities has confirmed the effectiveness of the campaign in instilling positive behavior change.
Save the Children reached more than 50 million people through the mass media campaign on how to prevent COVID-19.
ये हमारी तो अफोर्डेबिलिटी में नहीं था, तो इन्होंने बहुत ज़बरदस्त इसका कंट्रीब्यूशन है और हमारे बच्चे उसको इस्तेमाल कर रहे हैं और इस्तेमाल से भरपूर फ़ायदा उठा रहे हैं।
उन्होंने बहुत ज़्यादा अच्छा काम किया।
As we all know, IEC material plays a crucial role in encouraging behavioral change. So for this campaign, we developed various IEC materials, including these informative banners, brochures, activity booklets on prevention and control measures for COVID-19. This all content was developed in consultation with the thematic experts in WASH and health. These materials basically highlighted the hygiene and behavioral change practices and safe back to school guidelines. These were installed and disseminated within various government line departments, schools, partner offices, and within communities of Sindh and Punjab that were targeted by our intervention. So what you see here is some of the digital media posts that were shared across Save the Children's social media platforms. Our website, Facebook page, and Twitter have been used throughout and beyond the lifetime of this HBCC project to engage audiences, and especially young people, in the hygiene and COVID-19 campaign and generate awareness on the best practices behaviors. In order to extend the awareness campaigns in the face of new COVID-19 surge and to roll out elements of global HBCC, COVID-19 specific mass media materials were developed jointly with Unilever and its media and technical partners. We developed animated TVCs on the HBCC password theme that was hand, face, space, surface, and an Urdu dubbed TVC as well, and they both were broadcasted on national TV at the peak hours of the day. I would now like to invite you to join me in watching one of those TVCs.
दोस्तों कैसे हैं आप सब लोग? अस्सलाम वालेकुम भाई, पासवर्ड बताओ और अपने काम में लग जाओ। पासवर्ड, हाथ, चेहरा, फासला, जगह। हाथ, चेहरा, फासला, जगह।
सारा रुक जाओ, पहले पासवर्ड तो बताओ। पासवर्ड? हाथ, चेहरा, फासला, जगह।
रुकिए रुकिए रुकिए, पहले पासवर्ड बताइए और फिर दुकान पर जाइए।
पासवर्ड?
हाथ, चेहरा, फासला, जगह।
ये पासवर्ड कोरोना वायरस से हमारी जिंदगियां बचा सकता है।
हाथ, चेहरा, फासला, जगह।
Now that we have gone through some of the different kinds of media and materials developed for the campaign, I would like to take you through our methods for evaluating and gauging the efficacy of our campaigning efforts. At the start of the project, Save the Children did a knowledge, attitude, and practices study information for the behavioral change campaign activities. So as a follow-up, a longitudinal post-cap study was undertaken to assess the relevance and effectiveness of PCC campaigns carried out by Save the Children itself, government, and development partners in the 9 targeted districts. So the analysis of pre-cap and post-cap data indicates that how different PCC campaigns have helped to address some of the knowledge, attitude, and practices information gaps, myths, and misconceptions related to COVID-19. And also, as you can see, through this PCC campaign, we have assessed that using the right mix of different mediums like audio, visual, text, have constantly maximized the effectiveness of different messages. So here are some of the facts from the pre and post CAP study report. So the CAP survey in terms of changes in knowledge reports that the belief that the COVID-19 was widespread in Pakistan increased from 63% before the campaign to 86% after the campaign was concluded. So this highlights that an increased acceptance by the people in the 9 project districts of COVID-19 as a serious reality. In terms of changes in attitude, the mitigating the primary impact of providing health facilities to COVID-19 patients by the government, it can be seen that 12% of the people agreed to the government efforts before the CAP study, in the pre-CAP study, and it incremented to 7% at the post-CAP study level. So the post-CAP study indicates a potential for major improvements by the government to take additional measures to ensure that the provision of necessary health facilities to COVID-19 patients. However, in terms of changes in practice, the comparison of pre-CAP and post-CAP survey indicates that a decrease in practices of hand washing with soap has been seen, which is a key COVID-19 preventive measure. So the respondents identified that practical reasons such as non-availability of water at home or school and non-availability of soap for hand washing. So the survey thus helped us to determine the gaps in our campaigning efforts, and therefore then we introduced a practical wash element to supplement our campaign. Based on the learnings from the post-CAP study and to overcome the existing gaps in our approach, we supplemented the campaign with building of wash infrastructures in targeted schools and communities. In each targeted school, 3 children can simultaneously use hand washing station and wash their hands with soap and water that were included in the provision of hygiene kits that were distributed among children to make it easier for them to change their behavior in line with COVID-19 SOPs and preventive practices. Further, to add sustainability towards these interventions, trainings were provided to increase awareness among teachers about the pandemic and how to improve and adopt hand washing and basic hygiene practices in order to prevent COVID-19 spread. So the trained teachers are now playing their role in spreading awareness about COVID-19 IPC measures and reducing stigmatization among children and their parents. So, as a conclusion, the BCC campaign used ATL above the line and BTL below the line mass communication strategies to reach audiences nationwide. The campaign reached more than 98 million people through mass mediums. As a learning result, the campaign was successful in enhancing knowledge regarding COVID-19 precautionary measures. However, it was less effective in changing attitudes and practices at a large scale. So the partnerships that we formed were an integral facet of the success of the HBCC campaign. Connecting with donors, private partners, and development stakeholders enabled us to increase the outreach and impact of the campaign to an unprecedented level. So the humanitarian and technical expertise provided through these partnerships allowed us to effectively adapt and implement the global efforts of COVID-19 prevention to a Pakistani context and audience. From this CAP study, it was deciphered that a knowledge enhancement through BCC messaging was a huge success. However, in order to have a change in attitude and practices, some revamped strategic messaging and cues would have to be strategically developed. With the note that Pakistan shares similar culture with South Asian countries, thus the findings from our RCCE campaign would definitely be highly instrumental in informing campaigning efforts, profile targeting, and content adaptation to other countries across the region. Now I would like to say thank you very much everyone for listening, for your time and attention. Thank you again.
Thank you, Rimsha, for that wonderful presentation. 98 million people is not a small number. And during the pandemic, that definitely must have been a lot of work. What we're going to do is we're going to take the questions for you after Gita's session, because the time is also something that we have to take care of. So I'm going to go ahead with the next speaker, who is going to present something completely different from what you've seen till now, because we've seen large mass campaigns till now. And from Bangladesh, we have Gita Das, who is a Communications for Development Officer with UNICEF Field Office. She's a C4D practitioner who applies different methodologies at community level, considering the local context. And she's going to bring to us an example of a very, very local SBCC campaign that they run. Over to you, Gita.
Greetings from Chittagong Field Office, UNICEF, Bangladesh. I am presenting on how we addressed tribal communities' needs in remote areas through contextualized risk communication and community engagement intervention. The evidence was picked up from Chittagong district that was indicated by green color on the Bangladesh map. It was the second highest COVID-19 affected district in Bangladesh. It is southeastern part in the country, which region is comprised of hill areas, coastal belt, islands, riverine and marshlands. Among those, difficult to reach at hilly areas of 4 upajalas, namely Sitakundo, Hathazari, Mireshorai and Fotikchori, with life-saving information. Moreover, Tripura community is at disadvantaged stage. So, decided to reach at selected Tripura tribal community among diversified ethnicities in hilly areas, engaging local youth volunteer group, partnering with government by using community media. I would like to say something on Tripura community as they were target audience. Numerous Tripura community live in the Chittagong district in scattered manner in media dark areas. They have limited access to the basic social services, including life-saving information, obviously on preventive messages and vaccination on COVID-19. Low literacy rate among them. The state language is Bangla, but Tripura tribal community speak in Kokborok, and they don't have own alphabet. Some harmful social norms are existed in their community related to key life-saving behaviors. Disease outbreak is common in that community. Relevantly, I can provide 2 examples on their perceptions on COVID-19 and vaccination. 35 years old Rushmi Tripura from Mireshorai Upazila told, I won't take the vaccine. It is not good. If I take the vaccine, the blood will turn into white. You please leave me. I won't take the vaccine. Don't catch us. Another 40 years old person named Fulki Tripura from Fotikchori Upazila confidently stated, Corona will never be able to attack me if I stand for half an hour under the sunshine after anointing cow dung on my body. At that situation, initiated risk communication and community engagement intervention jointly with Chittagong District Information Office under the Ministry of Information and Broadcasting in Bangladesh, a local youth voluntary group named Bhorer Alo in Chittagong and UNICEF Chittagong Field Office. An intervention cycle was followed. Firstly, knew the situation through assessment based on data collection from Union Council, a last layer of local government institute, and key informant interviews. Then analyzed audience, behavior, and communication channel. After that, explored youth groups, selected volunteers, and arranged agreement with District Information Office. Later, planned and designed program. Developed messages and materials, pre-tested and finalized. Build capacity of volunteers, and finally rollout of COVID-19 campaign activities at Tripura community in 4 upajalas. Simultaneously monitored program by using Google Forms, collected community feedback by volunteers. Afterwards, established linkage with health department for ensuring services there. The campaign activities were involvement of representative of local government to prepare a program schedule and engage community leaders to check in with the community. Drum announcement through walking house to house and community, including crops field, for their attention. Disseminated messages by using megaphone. Arranged distance discussion at courtyard that was followed by quiz competition and distributed marks among quiz winners. Representatives of local government and respective community leaders also participated in the distance discussion in some cases. Moreover, displayed festoons on preventive messages and COVID-19 vaccination at public places in Tripura villages, like grocery shops and religious institutions. Volunteer conducted interviews with 2 men and 2 women in each location to know community feedback following prescribed questionnaire. Around 10,000 population, including children and adolescents, are directly interacted from more than 2,000 households. We faced few challenges to implement the campaign that were language barriers, as targeted community speak in Kokborok, but the state language is Bangla. Also difficult to reach remote areas physically. Initially, community did not accept messages and information due to their superstitions that were already quoted. Community leaders are not well motivated. However, there are lessons learned and got information for way forward. That are, this experience can be applied to other remote areas of Bangladesh. Build capacity of youth volunteers from respective tribal community for community acceptance and also overcome the language barrier. Script can be prepared in respective tribal language. Message dissemination by using tribal folk cultural instruments and activities. Interactive community dialogue backed by campaigns help addressing existing norms. Need to continue the intervention in certain interval. This is end of my presentation.
Thank you so much, Gita. And, as a part of Fresh Insights, to kind of see the work being done in such remote areas, such difficult to reach areas, as also Gufran also said here, Gufran also mentioned in the comments that such difficult and hard to reach areas. So if anybody, any participants have questions, please do type them in the chat box. While we'll just talk about the completely, different nature of the two campaigns that we saw right now. One from Pakistan, which is a mass media campaign, and the one from Bangladesh, which is so user-centric. So there is, I think, there is a question for Gita, which Gita says, did the intervention improve the vaccination uptake? Is there any evidence of that? You're on mute, Gita.
Thank you. Actually, we link established with the government health worker, but need to do more work. It is increased, but not much, because it is difficult to reach by the health worker. Now we are actually initiating how we can push community to come to the vaccination center. Actually, otherwise it is difficult. Actually, a little bit increase actually.
As we wait for more questions, I'd just like to tell everyone that the plenary sessions begin at 1 again, and Palak has already posted the links to it. So do join us back at the plenary sessions. Now, going to Rimsha on the work that you did in Pakistan. Do tell us, like, in terms of everything that we heard here from Indra in the morning and from Gita about how there is information fatigue, there is, there's the own superstitions of people where one refuses to kind of take the vaccine and things like that. In an atmosphere like that, when you run mass media campaigns, it becomes even more challenging because you've created all these television ads and then you're like, now I can't make changes to it. So do tell us if you face such challenges. Rimsha, are you there? Rimsha? I don't think Rimsha's around. So, okay. So, Gita, the other question that I had for you was, you said that Kaboom is a dialect and it doesn't have a written script. So I was very curious. So but we did see lots of posters and things like that there. There were banners and posters. So how did you manage all of that? And I'm also guessing that the literacy levels in the community is very, very low, right?
Hi. Yeah, thank you. Actually, we prepared in Bangla because there is no alphabet on Kaboom. But we mobilized. I have mentioned that we mobilized community leaders, though they are not illiterate. So through the community leaders from the Tripura community, they supported a lot actually, finally. But in the initial stage, actually they did not accept us, our volunteers.
Okay. I think Gufran wanted to answer the question. Yeah. Yes, please, Gufran.
Yeah, thank you. Thank you so much. I think it was great to listen all these three amazing presentations. And when I was listening both presentation from Bangladesh and one that Rimsha has just presented, so I was asking a question to myself that which will be an effective approach, considering in Pakistan we have a mass media approach, while and when you look at to see the effectiveness of mass media campaign, where you have mentioned about the fatigue of information, because when you go to the community, there are a lot of messages going on through media and through other channel, and for the beneficiaries to retain and to attribute that what has basically make the change in their attitude or practices, either we can attribute to our messages or it is from the different. So that is really challenging. So I was thinking that the local approach that they have adopted in Bangladesh, that might be more effective in the local context, where I don't know where there will be more actor, or the UNICEF are the only actor which was providing these key messages, which are very contextualized, like beating a drum. I think they are very innovative. So I was thinking that it might be possible that those localized messages are more effective in changing behavior, though she has mentioned that they have not much evidence, but I was thinking that localized approach is much effective. And for the mass media approach, what we learned in this one, that the innovation is the key. If our respondent, what they have mentioned, if they have to recall, like if you are innovative and you are local, you are addressing the local context and local target in your key messages, then they are going to really retain your messages, and you can attribute that their change is because of our work. Otherwise, I think to analyze and looking at the fatigue of information, it is very difficult to analyze that what has basically attributed in changing their attitude or practices. Thank you.
Thank you, Gufran. I mean, I would think that, from our experiences in India and hearing all these and the other experiences through the convention, I think every approach has had its pros and cons. Like everyone has had wins and misses. And there were equal challenges for mass media as well as extremely localized communications. One of the things that we faced in India was how there was no gender-specific communication. So, some of the work that we did was around gender-specific communication, because women had no idea whether they could take a vaccination when they're pregnant, whether they could get vaccinated if they're breastfeeding. So these were like real challenges. There was no communication around that, So I think it's a combination of all that worked together. Gita, you did have your hand up for something.
Yeah, yes. Actually, already that's to reply on comments. Actually, in Bangladesh, we also have mass media campaign to combat COVID-19. But those who are posted at the field office, we actually identified some answer pocket, media dark areas who actually don't have access to information. So that's why actually we just think that need right information to right audience by using right media, and we identify the community media. That's actually we plan, design everything at grassroots level, I think at local level, not at national level. Thank you.
Thank you, Gita. And I think since morning at the South Asia SBCC conversation, we've seen the power of social media at one end, and we've seen the power of extremely localized communities being addressed at the other end, and which is the reason for conversations like this being very, very important. Rimsha, your question was answered by Gufran already. So there is a range of conversations, a range of, like I said, challenges and impacts that we're seeing. And along with this, with keeping the time in mind, I would like to conclude the session. But before we go, can all the speakers please put their email IDs in the chat box. In case anybody has questions, they can write to you directly from there. Along with that, I would like to remind everybody, which Palak is already doing frantically, that please do join the plenary at 1 and use the links that she's shared. And along with that, do not forget that there are other sessions between 6 to 9 today, and request everyone to join those sessions and hear more about experiences of your colleagues and on the ground, and really understand what's been going on over the past couple of years. And with that, I would like to conclude the question, unless there are any more questions. Shohini, if there is anything else, you can let me know. Otherwise, we can conclude this question. Okay, so thank you everyone for joining the Fresh Insights. I hope you guys enjoyed it as much as I did. Thank you, Rimsha. Thank you, Indra, and thank you, Gita, for the very insightful presentations. We look forward to meeting all the participants in other sessions during the day. Thank you, everyone.
Thank you.
Bye-bye.
This is great.
Thank you, everyone.